If I was to ask you who was responsible for your health, what would you say? Is it you, the individual, your family, your GP, the government? The more you think about it, the wider the web becomes, because health is influenced by so many factors and many people along the way. What is social accountability? The World Health Organization says that it's an obligation of medical schools to direct their education, research and service activities towards addressing the priority health concerns of the community, region and nation they have mandate to serve. The priority health concerns are to be identified jointly by governments, healthcare organizations, health professionals and the public. Now that is an intimidating explanation. Let's try to simplify this. Obligation. Direct education, research and service activities. Address priority health concerns of the community. Identified by government, healthcare organisations, health professionals and the public. We can summarise this by saying, as a society, each and every one of us is equally responsible in directing medical education, prioritising our health concerns, and voicing our opinions or concerns about these issues. We need to identify what our community needs to achieve health, and we need to teach this to our future doctors to fill this gap, monitor the impact this has, and keep our thoughts open to improvement. So what would be the best way to find this out? What does the community know about social accountability and the impact it has on themselves and the health of our community? Now there's no better way to find this out than asking you. Asking every person in Christchurch is ideal but not feasible. In this case, leaders or representatives that collectively share the wider view of our community are ideal groups to ask. So we did that. We asked, you answered, and we listened. We posed 4 main questions. What do you think students are taught in medical school? What skills do you think medical students need to become good doctors? What would you say are the current unmet health needs of New Zealand? And how could doctors better serve your community or group? The strongest message we received was that doctors need to be culturally competent. This means an understanding that people come from all walks of life, that their age, culture, ethnicity, religion, and past experiences all contribute to who they are today and reflects their health today. Doctors need to have a sound knowledge of the medical system itself so they can navigate the best pathway for their patients. A better understanding of the services and care available will result in the best outcomes. Communication was a commonly recurring theme. Listening to the patient and understanding what their needs are. Making sure that medical information is heard and understood by patients. Doctors need to know the science behind medicine, but you also said that doctors need to take a more holistic approach to health, recognizing the effect mental, emotional and spiritual components have on one's health, not just the physical component. So why is it important to get your perspective? Because having a better understanding of what our wider population needs will help us train future doctors to better serve, protect and treat all the people within our community. So we'll leave you with a question. Have your say. What do you think we could do to improve the education of our future doctors?